Let's go ahead and get started. So I'm really excited for this seminar. We have Gretchen Van Wy with us. She has been really generous. She's she's the assistant commissioner of vital records for New York City. So she's here to share some of the experiences that her team has with modernization of vital records, the role that vital records has played during the pandemic. She has a rich background, not only in statistics and vital records, but also dealing with other problems such as obesity, social determinants. She's been with New York City for about 9 or 10 years. She earned her PhD from Yale University. So really excited to have her with us, for her to share her experiences with us. Gretchen, do you want to say something?
I'm happy to be here today. I'm happy to be here with you. Always enjoy talking about vital statistics. So I'm glad to be here with you today.
Great. So Gretchen, you want to talk about some of the statistics?
Oh, sure. Absolutely. So just a little background. I started in the role of vital statistics about in 2014 at the New York City Health Department. And when I started in that role, one of the biggest projects that we were working on was the development of our new system. We had previously had an older system, a system that was web-based, but didn't have some of the features that we wanted to see. We wanted something a little bit more secure. We wanted it to be mobile enabled. And we had a long list of enhancements and changes that we wanted to do with this system. Since 2014, a project called eVital has been an important part of my life in the Bureau of Vital Statistics. And from it, we have generated a lot of the things that you're seeing here on this slide. So of course, COVID has brought us back to our roots in the world of vital records and vital statistics. It's really pointed out how important it is to get good quality data on deaths. And that's what our system has allowed us to do. You can just see some examples of things that we've published related to this. So the MMWR that you see with the images of a street in New York City, that's from an MMWR that we published in 2020 that characterized the excess deaths that we saw in New York City in that first heartbreaking wave of deaths in the United States. So from this, we were able to pull in, characterize probable death and confirmed deaths by extracting data every day, doing a match with our lab data, with our partners at other parts of the New York City Health Department. Of course, we provide a lot of different data on the pandemic and deaths in the pandemic as well using this system. Just to give you a little background on the New York City vital event registration process and volume, we have millions and millions of records. So one of the things that we find in our world of vital records and vital statistics is that, sure, we have the records that we keep for each year, and that's one thing, but then there are the records that we accumulate over decades and decades, and that makes us have the keepers of important vaults and paper files, and also those same things, but in digital versions, over the past 10 or 20 years. In New York City, we have about 125,000 births a year. It's been declining slightly over the past few years, as it has been in the rest of the country overall. We have about 50, in general, usually about 55,000 deaths every year. And of course, both spontaneous and induced terminations of pregnancies. We have over 20,000 users who use our system, and we have payment transactions to support all the issuances that we do. In addition to what you see here, we of course have a lot of corrections that we do through the system. I always think that's about 50,000 corrections every year. So that's New York City in a nutshell.
Great.
Yeah.
So we'll be talking a little bit about, outcomes, and Gretchen will be talking about some of the outcomes, right? We know that government faces a whole slew of challenges today that the COVID-19 pandemic has exposed. Customer expectations has absolutely changed. They want a much more digital environment. The days of walking into centers and requesting certificates or licenses or going away, and they went away rapidly. It exposed the fact that a lot of organizations work in silos. In government, that's even more acute, and sometimes you even see it in the same organization. Data is all over the place. COVID-19 brought to fact how important it was to bring data together in real time, but also how to be transparent with that data. So it wasn't just for data scientists and epidemiologists and internal users, but it was really critical as political leaders needed to navigate the public through this pandemic, that people had good data. And then finally, how do you make decisions? I think vaccine deployment is another great example of that. How do they deploy the right vaccines to the right communities? What are the right populations that need to get vaccinated first? And you can't do that based on hunch and intuition. Is really critical for government. So when we think about vital records, it's really about, the customer service that's associated with it. How do we improve worker productivity and compliance? And I'll ask Gretchen a few questions about that. Obviously, data security is critical. This is not just about HIPAA compliance. This is, birth certificates are a form of identity, and it's critical that that's taken care of. And then again, it's about actionable information. How do we take information and make it actionable? So these are the topics we'll be covering today. So Gretchen, I want to talk a little bit about what started your journey on modernizing the Vital Records platform in New York City.
Sure. So, when you work with 20,000 users, you're always getting feedback. And so that is really has been what's driven, that's the genesis of change for us. We get feedback from our external users. We get feedback from funeral directors. We get feedback from medical certifiers. We get feedback from our staff. And so the reason why people wanted change was because we had a system that worked well, but we knew it could be better. And so it was really just essentially our desire for constant improvement and our desire to be responsive to the feedback we were getting.
Now, what were some of the key challenges that you faced during the modernization?
In modernizing, some of the challenges that we faced were, there's so many challenges when you develop a system like this, and obviously you're never going to make, it's never going to be, not everybody is going to have 100% of what they want at all times, but we needed something to be more secure. We had learned that fingerprint technology, although it seems like it would be amazingly secure, and it was a huge improvement to have that type of biometric technology. Facial recognition technology is actually even better. It's something that you can take to a court, and it's something that's less, it's harder to hack. It's harder to commit fraud with that. We had learned that with fingerprint technology, people can enroll different fingers. So anyway, we really knew that we wanted to make our system secure in ways that people weren't even anticipating. And we were one of the first to roll out facial recognition technology when the only others that were doing it were banks, and so and some other users. And this is to verify existing people. It was to get into the system. So making something that was more secure was one challenge. Another challenge was that we had often heard frustrations from funeral directors that they were chasing doctors, trying to get the doctor to sit down at a desktop computer so that doctor could do a medical certification. Well, in modern day and age, people don't need to be at a desktop computer to do a lot of things. They can be at a cell phone or at a tablet. And so we wanted to make sure that our new system was mobile enabled. That was a huge component of it as well. We wanted to be part of that transition to the mobile era. So those were two major things that we, were must-haves for our system.
Now, you bring up a good point. I know, your group is a very good example of an organization that needs to support multiple user types, right? User communities. And one is the citizen, the constituent resident. Another is your back office, the actual workforce that's implementing these. And then you mentioned another one, which is funeral directors and hospital worker and doctors and other. Now, how did you incorporate those different user communities into the process of modernization?
That's great. Well, of course, always in conversation, always talking to those users. The other things that we did is that when we started out, we did focus groups with our users. We hired a professional focus group company, the same company that the same type of company that you'd hire if you were developing a media campaign. We reached out and we created opportunities for our users to have facilitated discussions with a professional. So we organized that in the very beginning. We also, of course, kept in touch with everybody. And of course, when it came time for developing and rolling out pieces, we had testers who were those very same individuals. From a perspective of working with the community and making sure we served community, one other major enhancement that we did was we built a customer portal. So customers can themselves track the status of an order once they place it. And we built that and we launched that. And we did that based on a lot of our discussions with customers every day. We see before COVID, we were seeing over 100,000 people in our normal fulfillment lobby where we just issue certificates, and we were seeing another tens and tens of thousands in our lobby where we do corrections. So we're able to talk to people and observe their behavior, observe their pain points, and adapt to make their lives easier. Because when we make our customers' lives easier, we make our own lives easier. And so that's what we like to do. It's a win-win.
Now, when you were going through this journey or started this journey, did you anticipate an event like COVID happening? I mean, New York City is probably the hardest hit urban center in the country. Did you even anticipate something like this happening?
Well, it's interesting. We've always anticipated that there could be mass fatality events. So this is why we, in our system, actually did build in a feature that we did wind up deploying during COVID to address mass fatalities. And this is the automatic registration feature that was built into the system. We deployed that in, I think it was March or April. So COVID specifically, public health professionals have been calling for massive pandemics, for ages. So it's, that we're in the situation of COVID should not be too surprising to any public health professional, to any epidemiologist. The actual way it all played out here, of course, is devastating and could probably not have been predicted. But but the idea of mass fatalities that many jurisdictions have dealt with, that is something that we sadly always need to be thinking of. And so this automatic registration feature was something we built in, and we actually leaned on when it came time earlier this spring.
Yeah. To continue on, that's really interesting. I think, you can never predict an event like COVID happening, but I think having that mindset of emergency preparedness for different scenarios is, I think, really important.
Yeah, it's critical. Yeah.
Yeah.
And to be nimble. And the beauty of it was that we were able to deploy it. We had built it in, we hadn't tested it, but we were able to test it and deploy it pretty rapidly.
Oh, that's great. Now, can you talk a little bit about, when COVID started happening? We started seeing signs of it in February in the US. I think there were some earlier signs in January. Now, in hindsight, how was your team gearing up as people were trying to figure out what to do and how to react?
Sure. Well, the data that we have in eVital is on a daily basis extracted into a system we call our mortality surveillance system. Now, this is a system that we built post Hurricane Sandy to do real-time mortality surveillance. We made some tweaks to the extracts that were put into this system in March so that we could get real-time data through the mortality surveillance system. And we also implemented a number of daily reports that we use to monitor deaths. Now, it wasn't until March that we had the first COVID deaths in New York City. And so, we worked really closely with our surveillance and epidemiology team to kind of be aware, to have situational awareness about that. And, so we really worked in partnership with them and took the lead from them and, tried to be as responsive to them as possible so that we could give them the information they needed to respond to the situation on the ground.
Now, were you also in constant communication with funeral directors and the hospitals as well during this
Yeah,
time?
absolutely. Of course, we always were. We were, as you're aware, the World Health Organization and the Center for Health Statistics developed guidance for classifying COVID deaths early on. And so we were able to share that with all of our users. We were in real-time communication. We actually have our own in-house nosologists. So we actually classified those ourselves.
Okay.
We have some ways that we do that nosology that are slightly different. We want to make sure we cast as wide a net to capture all of the data points. And so because we were able to extract the literal text and analyze those literal text ourselves, we were able to not only submit the data that we usually submit to NCHS on a regular basis, but also do our own analysis through some of our programming that we've developed through Mortals.
Now that we're still in the middle of this pandemic, and it's putting a lot of, I don't want to say strain, but the health departments all over the country are actively still dealing with deaths and vaccine deployments. If there was one thing in hindsight now going through this pandemic that you could have changed or would have changed as part of the modernization effort, what would that have been?
Oh, that's an interesting question. Well, I don't think it's any secret that many of us would love to see things like digital issuance, digital death certificates. This is something that would complement paper records, but I think that's sort of the next big thing that we need to think about as jurisdictions, because that would even further reduce the need for in-person services and contacts. So that's something that's probably pretty far away. But just like some jurisdictions, Louisiana are developing digital driver's licenses.
Yeah.
I think, we've been talking about how do we get to a point where we have digital death certificates?
Mm-hmm.
And that's to me, that's the future. It's not something I necessarily would have expected that we could have done prior to COVID, but I do think that's the future of where we should be going.
Well, that's a really interesting point, because I think more and more, I mean, everyone has a secure device in their hand, today,
Most
and
people, a lot of people, not everybody. And that's been a problem. That's been a serious problem.
yeah,
Yeah.
but many people have
Yeah.
a secure device that's in their
Mhm.
hand. So moving away from the pandemic now and into the future, what role, and vital statistics have been, I think, front and center during this pandemic, along with a lot of other organizations and groups. Coming out of the pandemic now, what do you see as the role of vital records and this data in the larger group, right? So we've been focused on COVID, but where do you see, you talk about, digitizing birth certificates, where else do you see the impact now, thinking
Well,
about the future?
I think vital records and vital statistics represent 400 years of learning and improvement in the United States. I think there are so many lessons learned. I can't even probably, I wouldn't be able to enumerate them
Yeah.
in any kind of short period of time. So I think there are lots of opportunities for other forms of data collection to think about how to leverage vital statistics and vital event data. And so that's something that I would, I think our data partners, our epidemiology partners, our other partners, our data scientist partners around the world, that's where we could really think about ways to improve, across the board for data collection and understanding the world around us. Yeah.
Now, how has it been? How has the experience been using your platform? How have doctors embraced the platform? Doctors tend to be the toughest technology users.
Sure. Right. Yeah. So doctors in general, they've been fine. They've embraced the technology. We always have outliers. That's always the case. But, hospitals are now embracing electronic medical records. They're appreciating the value that EMRs can add to their practices by getting better understanding at a sort of big picture level of what's going on with their patients. And so I think there's a deeper appreciation of what electronic systems can do than there probably was, a while ago. And now we're seeing doctors that are, I guess this is what we call first generation,
Yeah.
but people who are, people who grew up using computers are now doctors. So it's just second nature.
Yeah. You mentioned facial recognition before, and that tends to be a hot topic in government, right?
Mhm.
How have you leveraged facial recognition and today and in your overall process?
Sure. So I just want to point out the difference. So there's been controversy around facial recognition, but we're using facial recognition in a really different way from how some other uses have been. So our type of facial recognition is the kind of facial recognition where there's somebody who is already a user of the system, has access to that system, and wants to gain access to that system, like on top of a username and a password. That's really different from putting a camera on a street lamp and identifying a person from the general public. That is not what we're doing. What we're doing is having somebody who's a licensed professional, a licensed medical doctor, a licensed funeral director who's creating a legal fact, and just verifying that their identity through this system, so that nobody's imitating them, so that nobody's fraudulently using their information.
Yeah, you're not using it to identify a person, you're using it to verify.
That's right. A huge
Perfect.
difference.
Very different. Very
Yeah,
different. And so you maintain the privacy and the security without kind of, getting into other types of privacy issues around
that's right. Right.
security cameras and
Exactly.
the criminal justice system may be looking at.
Yeah, that's not us. That's not what we're doing. Yeah,
Yeah, that's
very
right.
different.
That's right. So we've talked a lot about death and COVID. Let's talk about more of the happier side of things on
Okay,
the
should we get to babies?
we got to babies.
Okay. So yeah.
There's populations in urban centers have continued to shift and decline and so forth, and people are more and more scrutinizing the birth data coming out of these systems. Can you talk about a little bit there? And do you collaborate with economic development on this data, or how?
Sure. Yeah, of course. Our data are used for population estimates. We work really closely with our Department of City Planning, and they develop the population estimates for the city of New York. So who's born is important to figuring that out. That's a good complement to the data collection they do. We also, of course, work with our maternal, infant, and reproductive health colleagues, understanding, who's giving birth, the characteristics, who's dying, what infants are dying, which is a tragedy, and in a really important, of course, infant mortality is a really important public health metric. We're able to work in close real time with our partners at other parts of the agency so that they can respond to these situations. We also work really closely with our immunization registry partners.
Yeah.
Our data are the backbone of the immunization registry. Kids are, people are living longer these days, and a big reason for that is good vaccinations. And
Yeah.
so we help provide that backbone, that background, so that the immunization colleagues know, who to think about, even who needs to be vaccinated.
Yeah. No, that's really helpful. And it's the same platform that, doctors use as well and hospitals use to register births.
Of course. Yeah, absolutely. Yeah. So I like to think of our system sort of being the skeleton of all the work that we do.
Mhm.
It really has to incorporate all of the things that we do. And then through extracts and through interfaces, we provide data to other partners, so that we can, so that our public health colleagues can do what they need to do.
Right.
Yeah.
So when we look at, outcomes and, the data collected in during birth and death, right? Whether it's, and in the immunization, what role does vital statistics and your team play in actually improving health outcomes?
That's a great
From a data
question.
perspective, yeah.
Yeah, so we have very much a data for action mission and vision, and so we provide the data that we have to our leadership. And so the infant mortality rate, the premature mortality rate, the overall mortality rate, these are all provided to our public health partners, but also our commissioner, our mayor's office. They're part of how we measure the health of New York City. And so we provide it in those kinds of ways. There are also things that we do in terms of data quality specifically that are enhanced by our system. When I think of ways to get good quality data so that we can have the right number for the infant mortality rate and the right number for premature mortality and for any other statistic that we generate, our first line of defense against bad quality data is our edit rules, the edit checks, the things that we put in our system so that we don't let garbage come into the system, as much as possible. And that's the edit checks are the first thing that we do. And then of course we have a team that works really a lot on improving data quality in other ways, creating analyses, looking at variations and deviations from what we would expect, and does a lot of communication with facilities. But that first line of defense, those are our edit rules in the system.
Yeah, I remember when I worked at New York City, it was right around the time that they banned smoking. Right.
2003, the Smoke Free Air Act.
Yeah, it was a big policy change.
Yeah.
And the first in the country. So New York City has always been on the forefront.
Yes, absolutely. That's where we like to be. That's for sure.
Yeah. Now, were you able to use the vital statistics database and see over the long term, has this policy really made an impact? Were fewer New Yorkers dying of lung disease and cancer?
Yeah, well, we provide our data, we through our annual summary of vital statistics, we share our data, we track that. We take no credit at all for the work of our Bureau of Tobacco Control, but we do provide the data, that monitors those types of things, the death rates due to, tobacco related diseases. That's something we of course produce for our annual summary.
Yep. No, that's really interesting. Yeah, I remember that. And then they try to do things with soda and sugary drinks, and New York City has always been, and even with parks, right, always trying to improve the lives.
Yeah, absolutely. That's why the life expectancy in New York City in general is really good compared to, it's relatively high compared to a lot of other jurisdictions. It's really, public health policy helps make a difference, for all of those different kinds of things. Yeah.
Yeah. And I feel like vital records is a critical point in terms of understanding the impacts of those policies downstream, right?
Yeah, for sure. Absolutely. It's the core, it's the nuts and bolts. And then, yeah, it's the core, it's the foundation to understanding the health of a population.
Yeah, that's right. That's right. So this is one question that I have that, I think people have given me different answers to, but it'd be great to hear. So typically vital records and vital statistics is a state function, but New York City is the one managing it.
Yeah.
And frankly, New York City is from an economic and population perspective, just as big as any state and bigger than most states in the country.
Absolutely. Yeah, absolutely. So New York City is one of the 57 vital records jurisdictions. We're independent, DC is independent too. Yep. We are unique in that we're part of a state, but, my understanding is that we started doing it first, and we are independent in our policies and our laws. We're independent with regard to, we have our own institutions and other ways too. So yeah, it is a little bit unique, but we're a wholly formed unit, and it gives us a great deal of efficiency. We have a medical examiner's office. Mm-hmm. This is something that helps us get really good quality data when it comes to external causes of death. And we're very fortunate to have a medical examiner's office. We do not have a coroner system like other parts of the country. So we're kind of unique in that way. So
yeah, I can imagine that OCME, Office of the Chief Medical Examiner, are very strong partners.
Oh yes,
of yours.
Yes, of course. Yep, they're important partners. They're also, not only do they examine or sort of study the deaths to external causes, but they're also the funeral director of last resort for the city of New York. Yeah. So, so they have an important role from that perspective as well. And we
Yeah.
do have an interface with our medical examiner system.
Yeah, that's right. That's right. That's right. No, I think, the work that you and your team have done is a really good example of how you could have a fully integrated platform that interfaces with so many different parties, right? I think, whether it's out, private organizations, public organizations, nonprofits, other city agencies, federal
Right, right.
integration, right? It's
Right. And I think, yeah. And, before you were talking about areas for the future, the interface with the medical examiner's office is one interface that we have. But, the future and reality is that, aside from digital death certificates, I think another thing to think about in the future is reducing the need for double data entry and instead creating interfaces with the electronic medical record systems of hospitals. And that's been something that we're beginning to think about and experiment with a little bit. And so, in the future, it would be more, I guess it would be sort of just like more efficient is the best word to describe it, to have an interface with a hospital system that we could extract out the information that we need from their medical records from them, so they don't have to enter it a second time. And so that's something, we hope to learn from the interface that we have. We do have a project to work to use FHIR so that we can get sort of up to figure out interoperability in the best way possible. So that's a big area of growth for us as well.
Yep, that's right. And can you quickly explain to the audience what FHIR is? So for those that
Well, I'm certainly not an expert, but essentially FHIR is a standard for creating interoperable systems, meaning systems with interfaces. And the National Center for Health Statistics is very interested in this area, as are a number of different, IT agencies, not only, around the country, but I think really it's something that we all recognize this is a huge area for development. And so it's just a set of standards. Whenever you're going to make two systems talk to each other, you have to have, my understanding is that you really just need to have standards and a way of doing that. So part of it is just the technical standards. And yeah.
Well, FHIR, I think
Certainly I'm no expert in FHIR.
yeah, no. That's helpful. I think we're really quite excited about FHIR because it expands interoperability into so many different areas, and we're seeing it more and more. And I think there have been attempts at creating interoperability, and
Right.
that's been fragmented, whether it's HL7 or NEEM, but we think FHIR is going to be the de facto predominant standard within the next few years on how you interoperate.
Yeah.
So if you've had any advice for customers, for other health departments and bureaus of vital statistics that are looking to modernize, what advice would you provide? So going through this journey.
That's a great question. So I think the most important things are to really understand the life cycle of technology. I think that's sort of from a big picture. The process overall is really important to grasp, to understand the timeline and what's realistic, to develop really excellent requirements from the beginning. I think that you can agree and you will appreciate that the requirements are what the system is built on. And so getting people to articulate exactly what they want and what all their use cases are is the way you really build a system, and that you aren't surprised, or at least aren't surprised as much later down the road. In New York City, we had over 1,700 use cases when we went live with eVital, and that was in 2018. So now we have even more. So I think understanding how all the different ways you use your system and that you want to use your system is really important. And the other thing that I would add in is, think about change management and think about getting people to use the new system. No matter how similar it might seem to your old system, change is hard. And so change is hard for people to adapt to, and it can be very stressful for people when they have to do it for their job all day long. And that's that's what we are facing when we're developing new systems for, registration and of these events. So investing heavily in change management in addition to the development of the system and the testing and all the other pieces that you need to do.
Yeah, usually a lot of companies focus just purely on the technology side, but you're right. Technology is great, but without the change management, it's always going to fail.
Yeah.
And more and more
Yeah.
organizations are starting to
Yes.
realize that.
Yes.
And I think the one place where I feel that you have excelled at on the technology side, I mean, you've excelled in many different areas. So this is just one
Boy,
of many.
thank you. I
Um,
appreciate that.
yeah, is focusing on experience, right? What is the
Yeah.
experience?
Yeah, that's what it matters. Like at the end of the day, that's what matters, right?
That's right.
User
That's
experience.
That's right. And nothing else really matters in the end. Either it's going to be easy to use or it's going to be difficult. And I think if organizations focus more on the experiences of the people using their platforms or that are part of the process, it makes
Yeah.
things a lot.
Oh, absolutely. Absolutely. Yeah. And I think, yeah, we could talk about this for a really long time, but absolutely. Very important. Your users that's what it's all about. You want your users to be happy.
That's right. So with that, I would like to open it up to the audience. If there's any questions, we have about 20 minutes left. If there's any questions for Gretchen that you may want answered.
Sure. Happy.
Let's see, is anyone asking a question? Don't be shy. No questions. Okay.
That's great.
No, I think that's really good. I think we covered a lot of information and a lot of ground today. Any last parting words before we close off the webinar?
Yeah, I think I guess my parting words would be that change is sort of the name of the game in vital statistics and in vital records, and we achieve a lot of it these days through our electronic systems. So giving a lot of thought and attention to them is really important. Also, I'm really happy if anybody wants to follow up and ask me a question afterwards. We can make my email address available to everybody. I know a lot of people are probably members of NAFSIS, as are we. So happy to, handle questions that way.
We do have a question from Russell Sherwin.
Mhm.
So I'll just read them out. So Gretchen,
Sure.
what learnings on the journey, mistakes, very specific mistakes, would you share with other leaders taking similar journeys?
Sure. Well, I think, there's so many opportunities to make mistakes or to learn, to have learning experiences when it comes to systems. I think the area to focus on is there's so many areas to focus on, but one of the areas is to really make sure to have really good requirements going in. So getting all the right people at the table up front, your users of all types. I mentioned the focus groups that we had. I mentioned our own internal users, but also having a place where people can share their voice and their input about the system as you develop it throughout the entire thing. So one learning is that you'll always have to have the users, and it's important to elicit from all of your users all of the different ways that they actually use the system and not the ways that they have the time to tell you about right now. And so that might mean really trying to draw that out of some of your some of your team. And so because that can be something that can be frustrating for everybody down the line. Investing in change management is also, of course, really important as well. Um, as much as you can possibly invest in that, it takes a lot to really do that, and to message upward that to the people in charge that if it's not already included in your contract, if it's not already covered, you need to figure out a way to pay for change management or reorganize your work for change management. So that's something as well. Something else that we haven't really touched upon is that that we haven't touched upon is having a really good timeline and chunking apart time for the different pieces that you need. You want to bring in a project manager person on your own side who can do all that and stay on top of that for you. And it's a lot for somebody to develop all of the, to be the one person in charge of a project. So make sure that person has all the supports that they need. And that's a big challenge.
Yeah, and I'll just tack onto that, being living on both sides of the fence, working for New York City government and working in for a service provider for government, having strong leadership on the government side is
Yeah.
critical to success,
Yes.
right?
Right.
I think when projects go bad, so a lot of times it's the vendor's fault, but ultimately the customer needs to hold us as vendors accountable through the whole.
Yeah. And I think that's, one thing that we've also developed, and this is sort of the role of the project manager who can help out, is having good indicators for knowing if you're being successful. And so whatever those are for you, whether it's meeting your timelines, whether it's the number of fixes that you have to make, the number of QA issues in the system, the number of people that have been trained, make the indicators that you create the indicators to know if you're being successful or not. That's a big piece.
Yep. Let's go to the next question. Any advice about funding? Does CDC have new grants via COVID?
That's a good question. I don't know. I don't know the answer to that question. I know that there are different sources of funding related to COVID. I don't know how specifically they relate to developing new systems. I do know that certain features might be fundable through some of the grants, like ELC Cares and some of the other features, but I'm not as on top of the funding piece.
Yep.
Yeah.
Okay. We have a question from Yamaleth. Hopefully I pronounced that correctly. Please share your email address. We'll definitely make sure that we share Gretchen's.
Yeah, I'll put it in the chat right now.
Okay, great. Great, thank you. We have another question while you're doing that.
Mhm.
Are you planning next to use AI to be predictive and anticipate what the city would need? Example, peak of babies would require more daycare and facilities.
Well, what we are using now is our mortality surveillance system using a number of different syndromic surveillance technologies. I don't know that I would call them AI, but we're using technologies and developing algorithms to predict within 95% confidence intervals how many events we would expect, particularly for mortality. So I don't know that it qualifies as AI, but we are using, taking the data that we have and developing prediction models to make sure that we understand, that we know what's going on, for example, with mortality. And that's been really important during COVID, but it's also important just for monitoring all causes of death, to know when something's elevated.
Yeah. I think once we're done with COVID, hopefully, soon, but who knows when, a lot of the techniques that have been used to manipulate the data for COVID will be then applied to other areas.
Absolutely. Yeah, absolutely. Yeah.
Yeah. Great. Any other questions for Gretchen while we have her? She's quite busy, so I definitely would ask the questions now. If Yamal, I think Yamal, did you have your hand up? No. Okay, it was a mistake. So, yeah. So Gretchen, thank you so much.
My pleasure. It's wonderful we're here with you. You guys are my partners in this project. So I really appreciate your time and look forward to talking to you soon.
Wait, there's more questions in the Q&A section.
Okay, sure.
I completely missed all of those questions.
Sure.
Okay, great. So you hear my dog barking in the background. Yep. Some of the issues of working from home.
Oh, I see some other questions. So from Christopher.
Yep.
How do you leverage external partners, vendors, or other agencies to assist achieving your solution to ensure that you have comprehensive requirements, as well as considering future business needs? So I think the most important thing for doing this is that this is really challenging. So obviously you have your internal project team, but you of course have your business analysts, and you create an infrastructure to ask questions as much as you potentially can. And so having discussions, asking questions, but having that be captured through project management tools is what I would say, how to do that. And then one of the important aspects is capturing differences in data. How is that done? So we extract our data. I'm not sure that I am going to, if I'm properly understanding the question, but to capturing differences in data, you know, in epidemiology, we always fall back on what's observed versus what's expected. And so we use that sort of framework for doing data quality work. So we look at what we'd expect based on past years of data, and we see where the variations are. And through those types of differences, we're able to determine if things are, you know, off, or if things are just changing. And so we use the data, we have conversations with the users, and you know, we go through it in that process. It's an iterative process, and you know, of course, we learn a lot through that entire process. So I think that's it.
Is that it?
Yeah.
Well, Gretchen, thank you so much for your time today. This was really informative. We definitely really look forward. You know, there's been a long partnership between you and GCOM, and we really look forward to continuing that partnership. And you know, this session is going to be recorded as well, so we'll be posting this for people. So thank you so much for your time today, and look forward to continuing our partnership.
My pleasure. Take care, everybody. Be well.